Good evening, everyone, and thanks so much for joining us. Right now, our big story on 12 News at 5. 90% of COVID patients being treated at Banner Health facilities in Arizona are unvaccinated.
That's what the state's largest healthcare provider is reporting today. Team 12's Colleen Sikora says they're preparing for even more patients in the coming weeks.
A third wave with a big impact.
We are at a difficult part of the pandemic right now.
Dr. Marjorie Bessel is Banner Health's chief clinical officer.
This pandemic part that we are in is highly related to the vaccination rates.
Bessel says while there's a potential plateau of new COVID cases, it's the ones who do get sick she's expecting will have to go to the hospital.
Currently, it is forecasted that we will continue to see increases in patients who require hospitalization and ICU care.
Bessel says 90% of their patients are not fully vaccinated, and 2/3 of them are between the age of 20 and 65. They're seeing increases, too, in kids getting COVID. Between July and August, COVID cases in kids in Banner hospitals roughly doubled.
Most pediatric patients do not require ICU level of care or ventilator.
The staff to care for everyone is the challenge, not just at Banner, but hospitals around the state are struggling with.
We are busy caring for both COVID patients during the surge, as well as non-COVID patients who need our care.
Governor Doug Ducey is making $60 million for 750 nurses available. However, they'll only go to help hospitals who provide both monoclonal antibodies and offer COVID vaccines to patients when they're discharged. Monoclonal antibodies is a treatment used to help people with mild to moderate COVID symptoms who are either over the age of 65 or are considered high risk. But with 90% of people unvaccinated, Bessel is asking people to get their COVID shots.
Get a COVID vaccination so that you don't become ill, and get a COVID vaccination so you don't need to come to our hospital for care for COVID.
Colleen Sikora, 12 News.